The opinions expressed in this program are not those of CISA 7 or Time Warner Cable.
What's your tomorrow?
All right, I'd like to call the work session to order. Of note is we have 6 board members present. Mike Bleck is excused. He's at the National Association of School Board Advocacy Conference in Washington, D.C. We also are joined at the table by multiple people from the district administration. To my left, Dr. Langenfeld, district superintendent, and also Sandy Heller, who's our board secretary. And then we have Intercity Student Council members here, Priyanka Navani, who's president of Intercity Student Council from Preble, and Evan Grabarczyk, who is a student also from Preble. We're going to start with a special board meeting this morning, or tonight, gosh. And I will entertain that motion.
I move that the contract for the 2014-15 and 2015-16 school years for the superintendent of schools and learning, as presented, be approved.
Is there a second?
Second.
Is there any comments or questions before we vote? Sandy?
Jeffries?
Aye.
Brown?
Aye.
Ward?
Aye.
Wagner?
Aye.
Maloney?
Aye.
Becker?
Aye.
Carried 6-0. And we do that primarily at this point to express our confidence in the work that Dr. Langenfeld is doing for our district. And as a board, we feel very confident in the job that she's doing and think she's doing an excellent job. I will entertain a motion to close the special board meeting.
So move. Second.
All in favor?
Aye.
And then we'll start with the teaching and learning work session, which there are no agenda items for that, so we will move on to the...
And that concludes my report.
Sorry, I'm sorry. I forgot to give you credit for the 5-second work session. And then next we'll move on to organizational support work session, and that's facilitated by Chris Wagner. Oh gosh, sorry.
Thank you.
Too many lists.
Hang on,
Wait,
Chris.
Chris.
Hang on, Chris. We have to do open forum.
We have 2 speakers would like to speak, or 3 actually, in 2 groups, would like to speak during our open forum. This is a time for members of the community to speak before the board on any issue that is of concern to them or that they would like to highlight for the board. I will call up the first 2 people that would like to speak, Wayne Salverda and Debbie Thompson. And if you could state your name and address, and then keep your comments to 3 minutes. Thank you.
Deb Thompson from Wisconsin RX in Madison, Wisconsin.
Wayne Silverta from Wisconsin RX, also from Madison, Wisconsin.
We appreciate having the opportunity to be here tonight to address the board and the committee members that are about to make the potential decision on a change in pharmacy benefit managers. We represent Wisconsin RX. We are a member-owned co-op, and Green Bay Schools has been a member of ours since 2008. And as part of that, we've helped Green Bay Schools manage their pharmacy plan design. We believe we've been a very successful and a proactive partner with Green Bay Schools. As an example of that, the school district is paying actually 6.9% less than what it actually paid last year. Or in other words, the pharmacy trend has actually decreased by almost 7% in 2013. We also have, in terms of plan performance, the generic dispensing rate has been extremely high, and much of that has been due to our consultative partnership with Green Bay Schools. Wayne Silverda is our clinical pharmacist. He spends a good deal amount of time meeting with the committee and providing recommendations. So we've been, as I said, a successful partner. We also believe we've been a proactive partner. We've come to Green Bay Schools. Part of our value of a member-owned coalition is that we work on behalf of our members to renegotiate pharmacy contracts for our large membership of 200,000 lives. We came proactively to Green Bay Schools a number of times with enhanced pricing, and most recently we came with a new 3-year contract, which actually afforded Green Bay Schools a reduction of about $3.3 million over the next 3 years. Green Bay did sign that contract in, I believe it was in August of last year. So we were quite surprised when it was announced to us that the school district was going through an RFP process. We understand that consultants are hired for school districts. They certainly have a due diligence to perform. We were informed of that RFP process, I believe, in December, and provided some information to the consultants. So because of our strong partnership, because of our successful results, and because of what we brought to the table, we were very surprised that there was a change recommended. My understanding, based on the memo, we've received a memo that Ms. Marsh provided with that recommendation, and there were 4 bullet points. We have put together a letter in response that we'd like all of the board members to take into consideration, talking about those recommendations and the rationale. I think the biggest thing it looks like the school district was focusing on is $134,000 of estimated savings. And really, that is a big number when you just look at the number alone. However, when you put it in perspective, that actually only represents about 1.5% of the total drug spend. And that's an extremely small margin to make a change of vendors, especially when many of these analysis that the consultants perform actually have a margin of error that may be even greater than 1.5%. So we were, in looking at that as the financial reason, we had some concerns. We also had some concerns that the analysis, we were not brought to the table as part of the RFP process. My understanding is both the medical incumbent and the dental incumbent had the opportunity to present to the committee and meet with the committee, whom I believe maybe Mr. Wagner, you may be a part of as well. So we were hoping that we would actually have that same opportunity, especially being an incumbent that has worked with the district so successfully for the last couple of years. Our other concerns were that I believe it was mentioned there wouldn't be any disruption with the move because ultimately you'd be CVS Caremark. And yes, you would be staying with CVS Caremark, but you'd be accessing CVS Caremark through a different route. You'd actually be accessing it through C2, an entity that's owned by, or M3 is one of the owners of C2. So it is a different route of access. It comes with a different account team, and we think the account team is very key to the successful management of your pharmacy benefit. We were also concerned that maybe a lot of thought wasn't put into potentially the implementation. Yes, you'll stay with CVS Caremark because you're moving out from under our structure and into a different structure, there would be an implementation that's involved in a change in account structure, and with that comes the potential for disruption. We are able to provide a combined ID card. I believe that was another one of the rationale that was used as a reason to move. We can do that as well. We work with both Arise very effectively now, and we have many clients that work with UMR, who I believe is the other medical provider that you're looking at today. So I'd like to point out the letter, and I hope that the board received this. We had asked that it be distributed, and I'll turn it over to Wayne here to see if there's anything else that you want to say. Wayne works very closely with the district on day-to-day consulting and recommendations. And Wayne is a pharmacist.
Did a pretty good job on summarizing everything, and I have worked with the Green Bay Area Public School District over a number of years, and I was disappointed to see that we weren't given an opportunity as the incumbent to go through the proposal process as the others were. Some of the close work that we've done has demonstrated results in performance in terms of the pharmacy benefit, and I hope that's taken into consideration.
The last thing, I can't remember if I commented on it, I apologize, but we were concerned that there is a cost to leave the commitment that Green Bay Schools has met. So if indeed, we hope that you stay with us for all the other reasons that we talked about, our proactive, successful partnership. But if you do choose to go forward with that recommendation, there is a cost to leaving, and we just want to make sure that that was factored into the analysis so Green Bay Schools can make a good decision going forward. So thank you very much for your time.
Thank you. Next, I'd like to call up Sean Young.
Good evening. Thank you for the opportunity to be here today. My name is Sean Young. I am with CVS Caremark. I am out of Dallas, Texas. So definitely wanted to be before you tonight to comment on a few additional elements that actually Deb and Wayne alluded to earlier in summary. I am the strategic account executive that works with the Wisconsin Rx Coalition from CVS Caremark. I'm complemented from an account team, also based in Dallas. It's manned by an individual named Wilson Samuel and another clinical pharmacist that partners with Wayne. Her name is Denise Daniels. Unfortunately, they could not be here with me today. Having said that, I just wanted to reinforce the performance and the relationship that CVS Caremark has with the Green Bay Schools, Green Bay School District, and have enjoyed that partnership and certainly want to see that continue. From my perspective, at CVS Caremark, there are multiple venues to access CVS Caremark as a PBM. My main focus is to work with the Wisconsin Rx Coalition, a member-owned group cooperative, to ensure that there is transparency and understanding of the pharmacy benefits in place for the given member groups. There is significant financial savings that Deb hit on a few moments ago. There is also, from an account team perspective, a continuity in service. That's what I hope to bring. I've had the opportunity in multiple different fashions to work with Green Bay Schools as an account manager when I first started with CVS Caremark 7 years ago. Also had the opportunity to progress in the organization as what they call an account executive. Worked that opportunity for several years with Green Bay. Spent some time working on our health plan segment, which I won't go into a great detail there, but we work with health plans as well. From my perspective, I had the opportunity to come and work back with Wisconsin Rx a year and a half ago. And I did that during their competitive bid process with CVS Caremark. And then, fortunately enough, that was successful from a CVS Caremark perspective to retain that business, and really look forward to working with Green Bay Schools in addition to all the different pharmacy programs and strategies that they've had in place to get to that 6.9% negative trend. That's a key number on our business, and anything we can do going forward to provide additional venues and access to what they call pharmacy programs or plan design, we believe, from both the CVS Caremark perspective through the lens of Wisconsin Rx, that we can continue that downward trend, reduce total costs, and improve total health outcomes, which is the entire objective of CVS Caremark. There's a cost equation as well as a member service equation. Both of them are equally important to us, and hope to continue doing business with Green Bay Area School District. Thank you for your time.
All right, thank you. Is there anyone else who would like to speak before the board? Seeing none, we will now move on to our organizational support work session, which is facilitated by Chris Wagner.
Thank you. The first item is a clinic update.
Okay.
Thank you. I'd like to invite Mark Hillesheim from Prevea and Dana Carroll and Jennifer Vincent to the table, please. Mark Hillesheim is a service line leader for Prevea Health and has been working with us since the inception of the clinic. And Dana Carroll is the nurse practitioner who is our staffs the clinic full-time. She's also with Prevea. And you know Jennifer Vincent, who's manager in human resources. Well, the clinic has been open now for 15 months, just about. We've opened November of 2012. And so we have 14 months of savings that we've provided to the board. The savings in and of themselves, I think, speaks for itself. It's $190,500 savings, and we calculate that based upon the cost to run the clinic, which we pay for, and then what the cost would be had the employee go sought treatment in another way. But there's some intangibles that I think are very important. One is that it's very convenient for our staff to be able to come to a clinic, have low wait times, be treated, and then get back to work. Family members who are covered by the insurance also can come. And also they do ongoing immunizations for employees and their families and retirees, I forgot to mention, as well as the clinic provides all the pre-employment drug screens that we do. So instead of going to a clinic where the employees used to have to drive to the Prevea on Voyager Drive East, we just walk them down there, and it's very convenient. We have great communication between our staff, and I'd like to turn it over to Mark to make additional comments about his perspective.
Thank you for having us. From our perspective, we compare these clinics to the other 29 clinics that we have here in this area and down in the Sheboygan area. And try and look at similar trends, mostly in manufacturing, but that the other clinics hold. And the other clinics that we have in a full-time nature, really this clinic upholds very well from a utilization standpoint, from a monthly cost saving standpoint, and from a monthly visit standpoint. In fact, this clinic really, a year ago in November when it started somewhere in the 70 to 80% utilization right off the bat, and really has continued that. There's been some months that are a little bit better, some maybe a little less, but in the course of these 14, 15 months, we've stayed pretty consistent to 80, 85 percentile of utilization. And that would really be the time that Dana can actually see people and how much that time is actually booked. And that's really, a great number to look at. In our own clinic, we would add, staff to that. And actually, when you look at the graph there's a kind of a dip in the overall cost savings around February of last year, at which time we increased hours from 20 to 40 hours a week. And that was the case for both Dana's time and the medical assistants. And there are two of them here to help her out. The other thing I was looking at before I came today is what we kind of proposed to the school board and possible savings based on the types of procedures and people that we thought we could see here. And we had thought after a year of 25% of your utilization with certain CPT codes came here, that we could save about $162,000 in that year. With the addition of the nurse practitioner twice as much, 2 MAs twice as much, and some other services that have been added, like the disability case management piece, all those extra expenses, you still have surpassed the overall cost savings by $30,000 from what we originally thought. So I think the program is working really well. I think there's a lot of positive feedback. People that come seem to really find that it is convenient, and I think really appreciate that the school district has offered this to them as a way to control their costs. And we're hoping that as it's here a little bit longer, and the school district looks at what they're spending money in healthcare, that you'll really see those trends continue to decline, and more of the chronic conditions as well.
We've had a number of other employers tour our clinic. I've been part of some of them. Mark's been part of some of them. Dana participates. And so it's something that we're proud of, and we like to share the good news when we get tour groups through.
Comments?
I think one of the things, first of all, thank you. It's always good to hear large cost savings, but I think one of the things that is hard to measure, and Gina and I have had conversations about it, is the fact the time saving. So I know that a teacher had mentioned that they could come over on their lunch hour and be seen, you know, and get whatever they needed taken care of and get back. So there's no loss of instructional time for students. And that's hard to measure, but that's an important thing. And the turnaround time even to go have blood work done for anybody on staff is going to take more than what they can just run in and have it done and go back to work. So there's things like that. We've talked about how we could measure them, but we know that people have shared and expressed that has worked very, very well for them. And there's probably, as I look around the table, I'm not sure there isn't a single person here who hasn't run downstairs at least once for a little help. So I do think that there's really some cost savings that we haven't even captured that in the end are not only cost savings from a financial perspective and time out of work, but also what's in the best interest of kids. And, you know, that to be able to do, you know, proactive, and I remember Dr. Rye, the day the clinic opened, and spoke about creating a healthy workforce, which in turn creates the best in front of kids. And I think we're moving definitely in the right direction. So thank you.
I was going to suggest one person didn't run down there for help for sure. That would be Mrs. Marsh.
We called them to come up.
They made a house call.
Not to make a liar out of you, I just thought I'd point that out.
Maybe not recently. She's been down there. I've seen her.
That's right.
Any other comments? Yes.
I just want to point out that, just want to make it clear that when we decided to do this, if it were staff convenience alone, that clearly would not have been good enough. Right. Staff convenience is right. Nice, and not missing work, and somewhere in there the cost of maybe not having to take a half of a sub day certainly is in there, but the clear, we said when we approved this that we needed to see a clear, dollars and cents savings right away. We were told we were going to get it, and we got it. So thank you.
Yeah, I want to echo what Andrew said. I appreciate the work and, your help in setting this up, and we appreciate that it's been successful as advertised, right off the bat.
I'd like to express my thanks also. My major concern was about parking down here, that people would have a hard time coming in and visiting the clinic, but apparently that has not been an issue. At least I have not heard of it. Mrs. Marsh, maybe you said it and I didn't catch it. Besides employees, are any of their families coming also?
Yes, any family member who's covered by our health insurance, as well as our retirees who are covered by our health plan.
Thank you very much.
Thank you.
Yes, thank you.
Thank you.
And next we have recommendations on change of third-party insurance administrator for health, dental, and pharmacy.
Yes. I'd like to ask Cindy Van Asten from M3 to come forward, and Jennifer Vincent as well. Before you, I think I've been keeping the board updated that we were going out to do an RFP, request for proposal, for our health, our dental, our pharmacy, and our flexible spending account. You have before you the recommendations as well as some background on that. And briefly, we are proposing a change in the dental, the health, dental, and the pharmacy benefit. The health we're advising and we would be bringing recommended motions to the board if you so desire, to change our health benefit from ARISE to UMR, the dental benefit from the pharmacy benefit from Wisconsin RX to C2 RX benefits, and the dental from Humana to Delta Dental. The cost savings you have before you, they are if you'd want to put the screen up, there's the benefit plan and the potential savings with the rationale before you. We did not, we interviewed or had dental and health come in to talk with us, the two final vendors, but we didn't have the flexible spending account vendor nor the pharmacy vendor come in. It isn't a change in the services, and we looked at the factors that you see before you, which is primarily driven by the cost savings. I think what we'll do with the letter you received, which we also received, we'll look at that very, very carefully, analyze each of the points that were made, and we will get back to the board to verify what's in that letter. We do have the 2 weeks between the work session and the actual vote to do that, and I think we can do it very thoroughly. But I'd like to turn it over to Cindy to tell you a little bit about more about the details of what we're proposing.
Thank you. For the medical provider TPA change, third-party administrator, we're recommending a change to UMR. UMR is a wholly owned subsidiary of United Healthcare. What it offers to the district is...
Excuse me, the acronym, what does it stand for?
UMR doesn't stand for anything. It once upon a time might have stood for United Medical Resources, but United Healthcare purchased a couple of third-party administrators, one of them being Fiserv Health, which was also Wausau Benefits, once upon a time.
Formerly known as?
Formerly known as Wausau, Fiserv, and Pacific Care. Went to United Healthcare under the umbrella of UMR. And there's a couple other third-party administrators they also purchased. The UMR platform that we are talking about is what they refer to as CPS, which is a claims payment system. It's the old Wausau benefit claims platform that allows for great flexibility from a plan design standpoint and the opportunity for the district to manage with pretty great detail of reporting capabilities. It also offers, along with the fact that it's owned by United Healthcare, the opportunity to tap into United Healthcare's resources, one of those resources being their provider network. It is a proprietary network to United Healthcare. It's called Choice Plus, and that network has nationwide coverage as well as very good coverage geographically and within the state of Wisconsin. That change to network and the analysis that we did to show current utilization today versus that network is where yielding $3+ million in savings. The disruption to that network, specifically from a provider standpoint, is the UW system is not in network in Choice Plus with UMR under United Healthcare. Today, UW is considered in network. There are about 72 members currently accessing into UW Health, and the goal is to work with those members on a transition to care program over the next 6 to 12 months from July 1st through June 30th to transition over where necessary. Having said that, UW also serves as a center of excellence for many high-level care, transplants as an example. Those are still considered in-network. And a member accessing UW for that particular service will have been working with a care manager through the UMR care management system and through that process. So no one will be required to leave their provider if they're within UW for sure within the first 6 months. And if there's an issue after the first 6 months, we'll work on a case-by-case basis. Freighter, Mayo, Marshfield are all in-network providers under the Choice Plus network. Any questions on the network?
Yeah, I'm sorry, I don't understand. So you're talking about UW, there's no UW hospital in this community.
Correct, it's in Madison.
Right, and so I'm confused as to what it would look like for someone who's going to see her doctor, the doctor she has under the Arise network?
Great question, thank you. The network is almost a dead-on match. There is no other disruption. So your Prevea, your Bellin, your Auroras are all in network in Arise. They're all in network with UMR as well. UW was the only place we found fallout in network disruption.
Okay, thank you.
We'll have some additional coverage in the western part of the state that we don't have right now. That's in network.
Yes.
If there is a person, though, who is currently involved in the UW system, how would that work?
We work through what we call a transition of care. So for the first 6 months, that person will just continue through that care, although care management through UMR will get involved to work with that person. If after 6 months the person is still under care, they'll work through that on a case-by-case basis. If there's opportunity to transition a patient and that makes sense, then we would work through that. Otherwise, we'll work through it individually.
Thank you.
Mr. Becker?
Okay, so who says they can stay or they have to leave?
The district will be able to make that decision on a case-by-case basis.
It's our decision because we're self-funded and we would make that decision.
I guess I would feel more comfortable if there was just a flat grandfathering versus mandatory transition. And there will be people probably mandatory transition, or we wouldn't be talking about it. So I guess I'd like to see that at least looked at over the next 2 weeks of grandfathering existing.
We can do that.
Are there things that UW offers that none of the other providers offer, and then can we negotiate an out-of-network?
It's those
Or is it-
centers of excellence, transplants.
Right.
Those would be considered in network.
Yeah.
Those, okay.
And the United Healthcare Network uses the UW for centers of excellence.
Okay.
Oh, okay.
Okay, so then the things that are unique to UW would be,
Yes.
still be covered, okay.
And they're mostly the transplants.
Right.
That's not done.
Okay, thank you.
Also, we have the opportunity to tap into the resources of technology. So the ability for members to be able to go online and look up cost of services prior to having those services, with some ability to understand quality measures as well. And there's also opportunity as we move toward consumer-driven to help members understand their own impact to making such decisions. So the tools that we'll have available that can be customized to the district and the district plan designs will be very helpful in a go-forward basis.
What do you mean by quality of care?
United Healthcare has a tool that they call the Health Cost Estimator. It helps a member go out and look for potentially like elective procedures. I'll use knee scoping as an example. You can go look up that you're going to have a knee scope, see the facilities in the area that offer it, and within the United Healthcare Network and all the claim payment that they do and the quality, they look at episode of care and try to determine high quality providers that aren't maybe necessarily the lowest cost but could be the highest quality to help you make your decision. In some cases they may be lower cost, but it'll show you through a 1-star and a 2-star indicator the quality of that provider.
So let me zero in. How is that quality determined? By what
Based
measure?
on what?
There's a number of different measures that United Healthcare uses through the Wisconsin Health Organization, through Leapfrog and some different analytic tools, plus through their own systems. We could provide some further detailed information within the next 2 weeks for you to see exactly how that works.
So, okay, so let's say that platform functions very well. What benefit does that have to us? What benefit does that have to our employee who's utilizing that service?
Great question. The benefit that it has in both cases is it allows members to start to become more of a buyer or a shopper in the healthcare arena, which is very not transparent today. So it allows you to see the cost of a procedure prior to having it done, and it allows you to look at the differences from provider system to provider system. It pulls up the district's plan design, so it will know as a member what plan you have and what your out-of-pocket costs are. So in determining a procedure, you can see exactly what the out-of-pocket cost to you will be, as well as to the employer. The hope would be that members will use that tool to make wise buying decisions or start to use it in helping them to buy healthcare services.
Okay, patient John Doe has his right knee done by a certain orthopedist, and 3 years later it's time to have the left knee done. And there's a comfort level with that orthopedist. Will that person be allowed to choose that orthopedist, or are we going to be insisting that people go the
It's really just a
true
tool to
story?
aid people in making their
So
decision.
it's an advisory
Free
thing.
choice.
It's not
Right.
something that's going to make people.
Yes.
I would say too, in my opinion, that the information on the quality is still in its infancy.
Yeah.
That, it
I was
would
going to
have to
say,
be.
it would have to be.
I mean, it is. You know, I've looked at quality data, and from the other side, I've looked at it. We are going to be moving in a way where we're measuring quality of services. I know at the hospital we do it, but it's not precise. But what UMR is doing is they're starting to get that data and provide it to employees. But we aren't moving to the driving people to be with the lowest quality provider. They will still have the ability to select who they want to see.
Okay.
And this network opens up more physicians and providers to employees in network.
Well, you know, cost is a very interesting thing.
Yes.
Because sometimes people look at the highest cost as the best.
I also
Not
think
the
too,
lowest
it's how the
cost
cost
is the
is
best.
bundled.
Yeah.
Right, right.
There's a lot of factors that go into it, but it's a starting place to provide some tools for people who are interested to look and start people down that path. They also have apps, smartphone applications for those people who are smartphone techie. They could have their ID card, if you will, on their smartphone as well. So there's some tools, some technology that going through UMR will help us to increase, and there's some significant savings to the strength of their network.
I would say, though, you are hurting, correct me if I'm wrong, hurting people towards making more informed decisions.
We are. I mean, we want people to make informed decisions. You know, if we don't make any changes to our plan, and the cost of healthcare will continue to go up. So we have to impact healthcare. We don't want to reduce services. We don't want to keep driving up premiums as a way to stay even in the district. So when we looked at the cost savings that you see before you, over $6 million in just changing the medical vendor was a significant amount of money. It is an estimate, but it's an estimate based on the best we know today. It's looking at the history of the claims and projecting them forward. So we just feel that we really have an obligation to seek the lowest cost third-party administrator for the district when we can save this kind of money.
And I would, one of the benefits I see is just the ability as the consumer, if you have an elective procedure that's being recommended to you, the surgery or something like that, and you're not sure you want to go forward with it and things like that, if, you know, one of the factors is going to be cost, and how much is this going to cost out of pocket based on, you know, deductibles and co-pays and things like that. And I think that the more people understand how much procedures cost, you know, the more informed they are in terms of making those choices for themselves as to whether they want to have the procedure now or wait till it gets worse, and then they're willing to pay whatever that out-of-pocket cost is.
You mentioned the pharmacy benefit manager. We will, within the next 2 weeks, review that document and bring that back to you. On the dental administrator, we are recommending a change.
Can I just go back to the pharmacy manager? And I don't know, it's probably in this letter that I haven't only read the first page and skimmed it at that. There was some, I guess I would have a specific question to come back to us. There was some mention during the open forum about the cost of changing from Wisconsin RX to this new one? And I
$284,000.
Was that?
That's the front
Oh,
page.
early contract release. Okay, all right, sorry. So my answer is on the first page.
But what is C2RX?
C2 is actually a wholly owned subsidiary by 7 other organizations across the United States, similar to M3. C2 engaged in a RFP process with different vendors. RX Benefits is actually who handled that RFP process to leverage the size of all of the clients across the United States into the purchasing power of pharmacy. Pharmacy is actually just one component of the C2 leveraging across the United States the volume of people, the volume of buyers.
So is M3 in fact a part owner of this?
M3 is in fact a part owner of C2, and C2 actually works with RX Benefits as the administrator who does the contract negotiations with the CVS Caremark. So it's a purchasing house, if you will.
So, just to make sure I understand right here, so your firm is a part owner of C2RX Benefits?
Not
Or it's
RX
C2?
Benefits, just C2.
C2.
And C2 is really again, a group of agencies the size, feel of our agency that band together to put together purchasing power to leverage contracts, and pharmacy is one of those.
I guess, what concerns me here is that we have an incumbent who wasn't invited to the table, and our consulting firm, who I think by and large we've had good results. I don't have any problem with it. But we have our consulting firm coming to the table recommending it's something it owns as a vendor and recommends not bringing the other incumbent vendor to the table.
Well, that's not exactly true because we went to RFP and both bid on it. We didn't bring either to the table. We just looked at the RFP and did the analysis in terms of the cost. We didn't bring either of the vendors for the flex benefits to the table. So
But neither of the flex benefit vendors were also your consultant, right?
Well, C2 is really, RX Benefit has nothing to do with C2. That's a standalone firm similar to Wisconsin RX. We don't have anything to do with RX Benefits. It's C2 from a buying into the purchasing power that we access into, not to anything to do with M3.
My feeling is that we need to look at what is the cost savings to the district. Go back and look at the numbers that we have, the letter that we received today from Wisconsin RX, and bring you what the cost savings would be for this benefit.
I guess also important to me is, there's, estimated cost savings are important. They're very important. But, if there's a good track record of a member-owned cooperative where we are part owners, where we have, I think, better recourse than we do with for-profit firms, I think that counts. I think that counts for something too. We've had discussions about other places other areas where RFPs are quality-based and cost-based, and we look at both of those. And if I see a years-long relationship that's delivered the goods, I'm probably gonna have to see more than $100,000 out of a $250 million budget to get real excited about it. $3 million on health, that's a huge thing. So, and I just, going from a member-owned cooperative to a small privately held firm is a concern.
We will run the analysis.
Any other comments before there are different ways of looking at it, obviously. To me, $134,000 are too beginning cheated. But Mrs. Marsh, if I understood you correctly, you will go back and you will thoroughly look at this and what this firm has brought to us now. It's hard to analyze this, at least for me, at this point in time. So if indeed you find something wrong, incorrect with the figures you already presented to us, in terms of figures of recommendation, there'll be a change by the time we get to the regular board.
Yes.
I'd appreciate once you go through this, contact me. I would like to come in and go through that with you prior to the board meeting.
Sure. Can do that. And then Delta Dental is the recommended third-party administrator, and you can see the cost savings are $591,000 over the first year. Many people are familiar with Delta Dental. Some people have had Delta Dental, and they offer a larger network and deeper discounts. Any questions?
Any comments? It's nice to see getting a better rate, because I've always thought dental insurance was so expensive. And there are good reasons for it. I can never figure out why, but it's nice to see that savings there. Thank you.
Thank you.
Do you want to make any comments about the flex plans? You have that listed here.
We aren't recommending changes to the flex plan. There was not significant cost savings to be had with that, so we aren't making a change.
Before I end this portion, I want to thank you, the people from Wisconsin RX, for being here and sharing this information with us. I'm very sure you will be considered. I believe trying to get back to the I found very interesting. The service animals in the district. All I could think was that old rockin' roll something on your pony ride.
That must be really old, because I don't know that one.
Hey.
Ouch. I love the picture.
Whoa. Harsh.
I'm going to present this one so Jean can get home.
Bye, Jean.
Thank you.
Currently, we do not have a policy in place regarding service animals in our district. We looked at what the ADA, the Americans with Disabilities Act, as well as the IDEA, Individuals, help me, Claudia.
Disability Education Act.
Thank you. Requires for both students and staff and visitors with respect to service animals. So you have that in front of you. I think it details in great detail what those requirements are, as well as what the district's obligation is. I learned a lot about different kinds of service animals, including the miniature horse requirement. This is a new area where of animals that's being trained, because miniature horses have a longer life than dogs do, and they can perform more difficult tasks when it comes to needing to assist, needing more horsepower, I guess, or say, when needing to assist for these issues. So if you have any questions, please let me know. Otherwise,
about how big are these miniature horses? Out of curiosity, I should have.
About the size of
a Great Dane?
no, not even that big. They're about the size of a golden retriever.
Yeah.
Oh, really?
Yeah.
Yeah. We do not have any. We do not have any miniature horses right now. We do have service animals.
How many service animals do we have? One. A
One
dog?
for a student and one for a teacher. I thought we had a teacher who had a service animal. But
She retired last year. She retired, yeah.
Okay.
Well, it's probably good that we have this policy. I don't believe it's been an issue in our district, but I have read where it's been an issue in various areas where people have tried to bring different animals in for their emotional comfort. And bringing a Python around your neck for your emotional comfort isn't something I think we want to say. So, any comments? Or
No, that's great.
Thank you.
Thank you, Melissa.
District Auditor would be next.
Come on up.
With me is Paul Dennis from Shanks Business Solutions, and also Angie Robley. Got to remember that name. Get married, I got to keep remembering.
I got to remember it too.
Good to see you all again. See, what you have there is page 11 of the management communication letter. What I'd just like to say is included within the audit report itself are various opinions with respect to the school district. Those opinions indicate that the financial statements are fairly presented in accordance with accounting standards that apply to Wisconsin governments, including school districts. The financial statements actually have two different sets of financial statements with a reconciling page. One is on the full accrual basis of accounting, and that includes the value of the buildings less the long-term debt. What you see there is a modified accrual basis of accounting. That's basically cash in, cash out. So the fund balance represents available cash. In Wisconsin, that was a pretty cold cash in January, too, available for the next fiscal year. You can see the total fund balance in the general fund, which takes care of the general education students as well as special education at the end of the year, was $41.4 million, and the preceding amount was $38.6 million. Contained within the 41 is an assignment of monies to the self-insurance fund. So since the self-insurance, health, dental, which we've been talking about, since that fund was established back in the 1980s, at the end of each fiscal year, the district determines the amount of revenues or premium equivalents that have been charged to the district as well as its employees, less the actual administrative costs and claims. And that net then has been kept separate within the fund balance since that time, the past 30 years. So you can see that portion of the general fund balance accounted for most of the increase last year. You had an increase of $3 million in the self-insurance reserve fund. So that portion of the general fund balance is available, totaling $6.5 million as we move forward into the current fiscal year. There are various other funds within the general fund, the most important of which is the unassigned category. That unassigned category is $33 million, and is very close to the minimum fund balance requirement that was established by the board previously of 15% of general fund expenditures, which is shown at the top of page 12. Okay, the other major fund, which is contains $6 million this year compared to $3.4 million in the preceding year, deals with your debt service fund. And I think it's important now that there are some plans here moving forward to that the district understand that the level of debt for Green Bay schools is really quite low, $33 million. And about half of that represents debt that carries no interest rate at all. It's 0% interest. So it's the remainder of it is roughly 2%. So just fantastic rates on a relatively low level of debt at this point in time. The general fund balance, which is carried over, allows the district to pay its bills as they come due, despite the fact that your school year starts in July and you get your tax settlement in January and August. It's so inconsistent, as well as the state aid is generally paid in the last half of the school year. So you need that amount to meet your bills as they come due. And you've been able to maintain that level of fund balance at a point where it's very seldom that you require to have short-term borrowing as opposed to long-term borrowing. So that's also a positive thing, especially what rating agencies and third-party lenders would look at when they look at your financial statements. The other major item that we hear about is the other post-employment benefits. Other post-employment benefits are those other than the Wisconsin retirement system. Normally that consists of a portion of the health insurance that is paid to retirees, and also it will be including a population that qualifies for an early incentive program. So every 2 years, the district hires an actuary to determine what that amount is, and we're up for one on this fiscal year. So there's just some additional information here on the last page of the communication letter, which should be considered when that actuarial study is done. So although, in summary, you have there were no compliance findings with respect to federal or state grant programs. So the overall financial condition is excellent on both a short-term and long-term basis. And we appreciate all the help that Angie here and Alan give us when we're here in the summertime. Any questions or comments?
Just to be clear, our fund balance on June 30th, 2013 was $41.4 million, and that is the number. Although there was an unassigned amount that was near the 15%, the board policy is in fact the total fund balance, correct?
Correct. The board policy is 15% of expenditures, 33.7. The total general fund balance, you're right, it's 41.4, of which included in that 41.4 is the 6.5 for health insurance.
Right, but per our policy, we're not a hair ahead of our policy. We are $8 million ahead of our policy.
Correct.
If I could say something.
Well, and our hope is we will be using $2.1 million of that.
For the record.
If I may go back, in the past I've always heard, I believe I've always heard figure 20-25% is a recommended figure for the fund balance. Is that correct in the past?
Well, I think the 20 to 25% is what has been shown in the audit as far as to be able to handle the cash flow problems that we have.
We've recommended 20 to 25 for many, many years. I think the key thing here is that your fund balance policy set minimum fund balance. It didn't give a range, it just set a minimum, which is on the low end of that 20 to 25%, but still certainly fair, reasonably close to those suggestions.
So I mean, your posture still is it should be closer to 20-25%.
We feel comfortable with the 20% level. Though there will be times when you'll have short-term borrowing, which isn't a catastrophe, of course, but going too low on there's been certain districts that have run into short-term borrowing problems, especially a few years ago when we were really in tight credit conditions. Normally you can go out for short-term borrowing, there's no problem at all to receive the funds from banks. There has been a couple of cases where it was temporarily difficult to obtain that financing, which was very unusual, but once we saw that a few years ago, I think we feel a lot more comfortable with continuing on giving the 20% range there to maintain your fund balance, just to avoid those types of possible problems that come up.
There were districts who actually did not receive any bids to do their borrowing for their short-term borrowing.
I'm hearing that you're comfortable at 20%, but I'm not hearing that you're comfortable at 15% minimum, which we've established as a board. Are your thoughts that we should be looking at raising that to 20, or where are you with that?
Raising what now?
The 15% to 15%.
220? No, I'm not. I think I was trying to relate back to, yes, we use 20 to 25 as a range. And when the district went with a minimum of 15%, we thought that was fair and reasonable in relation to what we had said over the years. So it's an estimate. And we think the estimate is reasonably close.
Wouldn't there probably be a difference, too, between what a 15% fund balance means to a district of this size versus if a district had, say, a $2 million budget? I mean, the difference between having $300,000 or $500,000 in the bank could be one thing. One transplant surgery, if they're self-funded or something, could throw it completely out of whack more easily than you could in our size. Is that fair, or am I? I'd be much more open to a bigger fund balance if the scale was smaller.
It's a district by district decision.
Well, the key is, I'm sorry.
That's okay.
Is not the key whether we have to go into short-term borrowing in any appreciable degree on what sort of fund balance you keep?
Right now, we're doing $10 million of short-term borrowing. Used to be $24 million.
Right.
And what's the interest?
The interest has been, what, 0.7%?
You pay 0.7% for a fraction of a year. I'm just not seeing where there's any problem or emergency there. It's worse to me to set the funding aside than to potentially pay 0.7% interest for a fraction of the year.
But you have to understand, I mean, at one time, we were at a negative $3 million health insurance fund balance. I mean...
No, that's why you still have the 35 in there. You can.
Well, I mean, it's just you don't know where the cycle is going to go.
So tell me again, what are you putting in, what's part of our fund balance is for insurance purposes? Did you say 6?
Right now, the self-insurance for insurance is $6.5 million.
And that's part of our fund balance?
That's part of the $41.4 million.
So are you saying you would be comfortable with the 15% including the insurance piece, or in addition?
Would include that within the total. Right now, we have a $41.4 million fund balance.
Right.
Which is over the 33.7 would be the minimum.
Would be the 15%. That would be the 15%, but then if we take the 6.5 million that we're allowing for insurance, then that drops it down to...
Well, it is part of our fund balance. The health insurance fund balance is part of our total fund balance.
If your claims were interest and that amount went away, maybe that's what you're trying to say.
Right.
We're right at the 15%.
Right.
And we separated on our total just so we can see where we are as far as health insurance self-funded. And dental is part of that too, which is a small amount that isn't really.
Okay.
So that money, that 3.8 million went to 6.5 million because we saved.
Because our health claims.
Because our health claims were less than.
Correct.
So we put that savings right into our fund balance.
Right.
And it's really to keep a measure of where we're at on that.
Okay.
Everybody have it all figured out now?
We're all figured out.
At this moment in time, yes.
I know we have this report that came to us tonight, so we haven't had a chance to truly digest it. And
Right.
we will in the next 2 weeks, so we can have further questions. Any other comments?
And if you have any questions, you certainly can email me any questions from anywhere in the audit report, and I can get you the answer.
Well, thank you very much. Appreciate it.
Thanks, Paul.
Always nice to hear good news. And now we have referendum communication plan legal update.
Now we have the one before that. Time and attendance system.
I'm sorry, time and attendance system?
Yes.
Thank you. I didn't see anything attached to it, so I thought that was just a placeholder. Since we didn't meet on Friday.
What we're looking at is a time and attendance system, partly for HR, partly for payroll, because we have a lot of employees who are hourly employees, and we need to make sure we pay them the proper amounts. We certainly have, Melissa has shown us, the things that we need to make changes in the way we are paying our employees to keep within the law. And we have looked at 2 different time and attendance systems, and we're having discussion on trying to come up with a recommendation to the board in April. And I'm going to talk a little bit about the Affordable Care Act and the
Yeah, with some of the changes that are coming with the Affordable Care Act, one of the things we have to be able to do is count the hours that people are working. If they're working 30 hours per week, we have to offer them benefits. At this point, we don't know what people are working. Our subs, for instance, we have to be able to track those numbers to know who we need to offer benefits to going forward. So having a time and attendance system will afford us the opportunity, the ability to do the tracking that we need to do for the Affordable Care Act, as well as the Fair Labor Standards Act, to know with the hourly people, again, what hours are they actually working. Right now, they're filling out a lot of timesheets. We have an assumption, they're working on an assumption as far as how many hours they're working in a day, but we need to know the actuals as far as what's happening, not only for the Affordable Care Act, but also to make sure we're paying appropriately.
Since I've been here, all of our hourly people have been actually paid, had their annual salary amount and divided by how many payrolls they are. They were paid a certain amount each payroll, and should they leave during the year, a calculation was made. Have they been paid too much? Have they been not paid enough? And so our current system, the way we have done that, we're going to be changing to taking hourly employees and paying them like hourly employees, and that they will be doing timesheets, as a lot of employers do, to be able to track the days that they are working and to perform the calculations for when are they eligible for overtime, versus and looking at their attendance to see if one of the days was a vacation day, which doesn't count those hours for, getting overtime. Those are what we need the software to do, because we've taken hourly employees and really have never paid them as hourly employees, and we need the time and attendance system to track the hours that they are working for the reasons that Jennifer has talked about.
Are you saying by that, a little bit of what I heard there, are you saying instead of dividing it out, you really have to pay them whatever they work during that time period?
Correct. Right. And that's how we will then calculate accurately whether they are eligible for overtime.
And right now, it's a manual calculation on payroll's part, so this will automate that process as well.
And when we looked at the payroll, when Carol Fritsch left and the payroll manager left and 2 of the clericals, one retired, one also left, and we had one person left in payroll before Angie was hired. Part of the reason we eliminated one position in payroll was looking forward to the timekeeping system, where instead of the payroll calculating all the overtime or whether people have overtime, the system will do that. And they will go through and make sure that the review the calculations. So we should be able to to pay them more quickly, more accurately, and we'll gather the information that we're going to need for Affordable Care Act and Fair Labor Standards.
President Warren?
we going to at some point approve the purchasing of this
Correct.
software? Is that
We're
right?
looking at having a recommendation to the board in April. We just
Oh,
wanted to
okay.
bring it as a discussion item, just so that you're aware that we've had two demos and RFPs from two different vendors, and we just wanted to bring it to your attention.
Mr. Becker?
Are there only two that can handle a business of this size, or really truly only two interested?
Well, we sent out RFPs to
Was it 6 or 7?
6 or 7 companies.
And only 2 responded back.
And one is a national company, and one is one that has worked with the software that we currently have. So the financial software, the payroll software we have. So we have 2 good candidates. But there were only 2 that sent back the RFPs.
And then just to be clear in your comment before, although on a technical basis we've been paying hourly people by dividing up the salary, that just to put it out there, it doesn't mean in any way that people were denied overtime or anything. It was just that it was a manual after the fact calculation and a lot of extra work.
A lot of
But
manual work.
they did get the overtime they qualified
Yes.
for.
Any other questions? The only comment I have, I'd appreciate the next time you have a synopsis along with your presentation here so we can read it ahead of time, because here we just have a topic, time, and attend system, nothing under there to orientate
I mean, there
ourselves.
was something a paragraph in the update regarding it.
Was there? Okay.
Right.
I'm sorry, I missed that then.
There was.
Thank you. My error. Okay, on that?
Okay.
Next is referendum communication plan.
Is that something?
But my
The referendum
computer is
update.
going crazy right
Oh,
now,
I
so I
think
can't get
we,
in.
we were going to just.
It's got a 2 it's from you.
Discuss those until February 17th at the, during the legal update, but if you have any questions right now.
No, I read it.
Okay.
I think just as an FYI, for the communications piece, one of the things that is available now, and it is available on our website, is the narrated PowerPoint. I know that our principals this morning use that with their staff, and they also have a do and do not, because we certainly don't want staff during school hours to promote any position, but factual information. We have a referendum quick fact handout that really defines some specific reasons why the referendum, and I think the other piece of that, Alan's finishing up and wrapping up a Q&A around facts, and then the other piece goes to a nice breakdown of the various projects within the referendum by dollar, by reason, by year, and so forth. So with nice photos and so forth. So one of the things we just wanted to make sure is that as we're going out and having those conversations and people are aware those resources exist, we're putting together, there's folders for those that are going out to communicate the facts to the community, and I just wanted to make sure that was, I think that was our...
There's no PowerPoint in our folders.
All right.
I have quick facts and information sheets, but no PowerPoints.
No PowerPoint handout.
And I would assume that most of us would want to do what Alan does and follow the PowerPoint by paper, because we won't have the ability to project the PowerPoint, I would guess.
Well, if the place you're doing it, I mean, I've projected it on the screens up in the libraries.
But I think it would be very critical to have.
But I can get you electronically or however you want.
I mean, that would be another option, which a flat,
I think the hard copy is probably going to be something that we can use. We're not going to have necessarily that capability everywhere we go.
Yeah.
Like
I've done
especially
the hard
these.
copies also.
Yeah, and if we could get some hard copies.
Good. We'll have quick facts.
For our packets, because
this is
I think that would be helpful. So Sandy, can we get those and then we'll get
And
you.
the link to the PowerPoint, so there's a link, there's a PowerPoint, the PowerPoint's on our
PowerPoint's
website.
here. Is it?
I mean, I saw that you had emailed it to
It's
us.
actually not, the link is, it's not on the website, right?
It's uploaded to the district's YouTube channel.
Correct.
To the YouTube channel.
But there's a,
Because, see, this is the thing, because, you know, the lots of people have, I would like people to be able to access it if they have a smartphone, if there's Wi-Fi capabilities, to just go ahead and pull it up and look at it that way.
You can pull it up.
That's what
I
I'm
mean, the other
asking.
people we're presenting to?
But can the website have that? Does the website have that information?
Well,
that
but the
people-
website, the YouTube is better, because isn't that, I'm asking the kids now, young people, more mobile friendly, YouTube?
Sure, yes. But I mean, can our website have the YouTube link is my question.
does.
It has that,
Yeah,
okay.
yeah.
Okay.
We check the box to make it mobile available on YouTube.
we'll have further information, but I think having that PowerPoint will be key and having that access so people can look. I mean, people could even, while you're presenting, if you don't have the screen,
That's what I'm saying.
they could just pull it up on their phone. Now,
Yep.
will they get Alan speaking on it if they do that?
Yes.
Okay, so
They could
that
just
might
mute
be,
it.
you might.
Or they could listen to Alan as opposed to us.
Yeah, I know, Alan's probably better at it than we are anyway.
So if we have Wi-Fi, which we do in the schools, and we bring our computers.
You can hook in and
Can you
project
hook
it.
in and project it
Yeah.
on the computer? Boy, but then you've got the whole PTO huddled around you.
Well,
looking.
no,
No,
they have
You
a-
can project it.
Project it, like
Which
they all get in the
which they all
classrooms,
have.
We all
right?
have that.
So-
Yeah.
Okay.
I think the key will be to make sure that principals, I mean, I think they could queue it up and have it ready to have media people. Would that work?
That's what Southwest was doing tonight.
Until that Mark had that
Yeah.
available.
Yeah, because you're sending me.
But probably the Lions Club in Bellevue,
They might not.
they might not. I go tomorrow, so
Right,
can I get
and-
those copies tonight?
But Jefferson does.
Oh, but if Jefferson's a more intimate group, I may just, and we can probably collect and reuse the hard
Yeah.
copies. People aren't going to need to hang on to their hard copy of that because you're going to have the quick facts, they're going to have the other stuff. So we'll just, if you could,
I bring along the hard copies and my flash drive. I mean, that's all I got.
Right.
Either way, at least I've
So
got
you have the
something.
flexibility to pick how you want to do
If for
it.
some reason they can't get the.
yeah, so if we could get some hard copies, then we can just use those repeatedly.
Yeah.
Unless someone really, really wants one.
Yeah.
Are you asking for that by tomorrow? I mean, I have a presentation tomorrow. I don't know whether anybody else
Sandy
wants
says
it.
she'd give them to us after the
Yeah, I
meeting.
think we all do. It's quite a crowd.
Okay.
Yeah, I've got, yeah.
I'm out
Mine's,
too tomorrow night.
mine's
so-
tomorrow. Is yours tomorrow, Katie?
No, I'm not until the
I
6th.
have mine,
Okay.
I have mine tomorrow night, so, yeah.
Okay.
But you're not coming back here before then?
If they're available, I'll take them tonight, otherwise I
Right.
could. But, yeah.
But even without that, as Superintendent said, the building should be able to bring it up.
Right.
Their system there, just so we let them know ahead of time.
Yeah, and I think we can follow up with that, but it's nice to have that in your hand.
Right.
I like it to
Yeah.
reference and,
By your last statement, I didn't quite follow. Will you ask them the buildings to do that for us, or should we contact them before we go?
well, I think we can go back and ask the buildings to do that for us,
Okay.
don't you think? Can we do that through your office, Kristen?
Yeah.
Thank you.
Okay, thank you.
That'll be helpful, but you'll still want hard copies, like Alan said. Good idea to collect them back. We probably left a few the other day that we didn't need to unless you collected them up for us. so.
And just as a reminder, this is purely informational.
Yes.
We can't actually tell someone to vote yes on the referendum in our official capacity. This is purely informational. We can provide a compelling case as to why they would want to choose to vote yes, but we can't say vote yes. That's why when we did the Howe referendum, we put 2-foot letters and just put vote in every window at Howe School. We didn't say vote yes, we just said vote. And we let them.
I never understood the rationale for that law, but
But it's there, so we have to.
It's about government people.
We can have a long conversation, Dr. Wigner, if you want to.
At our legal update
Over
in 2
coffee
weeks.
sometimes.
That's right.
No, at our legal update in 2 weeks. Yeah, when she
Yeah.
presents the legalities of all this. So file your questions away.
Well, just another way in my mind that we always have our hands tied behind our back, it doesn't make sense,
Yeah.
but to me at least. Okay, Annette, thank you for
Just,
putting all this together.
Reading your document, it just, there's this fine line between what we can and can't do.
The fine line is very gray.
Yeah.
Right, right.
But better to err on
The side of caution.
the
Right.
side of caution.
Now, that said, our employees can certainly, and I guess I should ask this now, our employees can talk outside the school day all they want to vote yes.
So can we, individually.
That's the question, we as board members, outside this capacity here or in a school when we're talking about this.
You as an individual have the right, have the same constitutional rights to advocate for a position. You just can't do it as a board member. You need to do it as an individual.
So when we go
Right.
speak as a board member, we can't do it there.
Right.
But we can
Correct.
talk to our neighbor and our.
So even when you go to community groups, you have
That's
to,
what I'm clear for.
yeah.
Okay, thank you. They can't figure out what we're for.
That's right.
Well, I think the handout we didn't include, but the principals received a handout that Melissa and I put together that really defines that students are not to be involved in any conversations or receive literature or anything or information. It's intended for the voters and the adults and not for students, and that was very clear in that document.
Well, but we do have students that are over 18 that do vote. How about them?
Well, I'll defer to legal counsel. We really, it gets very confusing, and if I'm sitting as a social studies teacher in a classroom with 17 and 18-year-olds, I don't know who's voting and who's not. I just think that...
Are you saying that they can't even give facts about the referendum?
I don't know that that would be in the best interest. I think if any student would ask, I would steer them to a website and could have them contact.
I mean, it seems to me in social studies class that'd be a real life lesson of what's going on, how things are handled.
Yeah, have we had student...
I'm saddened by the fact that I'm not, just because the government wouldn't consider teachers able to do this in a bipartisan way, just that we can't even get information on the referendum. So we're not even able to get handouts on pure information.
The advice from WASB and others is that this should not cross the line into the classroom.
But even though these handouts have followed all these criterion,
people look at students versus, for the most part, most of our students are not adults, so the law and outsiders look at students differently than it does voting majority age individuals.
Sure. And no disrespect, but even if we're not voters, I still feel like we have the right to be informed about such things.
Absolutely, you have the right to be informed. We just can't do it in the classrooms.
But are students permitted to request information at, say, an intercity student council meeting?
Absolutely.
Yes.
Absolutely.
And they could attend any of the sessions that the board has at any school building or any place else.
And they could access all the information
just
online.
can't be taught as part of the curriculum.
Yeah.
Correct.
Okay.
So can there be the same informational packets that are handed out to anyone else? Could those be on school office?
Yes, absolutely.
Okay.
Yeah.
Absolutely.
So you can have access to the information.
Okay.
It just can't be taught in a particular classroom. And I don't know if you're able to be at the intercity student council meeting on the 13th, right?
Yes. February 13th?
Yeah.
That would be helpful. Along the lines of...
If that works for you, because it's early in the morning. It's
I can't remember if we...
Here?
Here.
Yeah, sorry, Brenda.
No, it's okay. I didn't get called on, so...
Brenda?
So I was out of turn anyway. Can we, and I can't remember if we've done this before, but can we send this information the referendum quick facts home in those brown envelopes to parents? Or does
Tuesday
that count
envelopes?
as a child taking that home?
We're impatiently waiting Lori Blakesley's arrival, and when Lori gets here, we are going to put together our communications plan for what's going home to parents and how it's going home.
So we can send
we're
things
working
home to
on that.
parents. Okay. All right.
Yeah, because we're less than 8 weeks out.
Yes, we will be working fast and furiously.
I just noticed I'll be in Provo at 5:30
Really?
on the 5th for what it's worth, so.
You what?
He'll be at
I'll be at Preble at 5:30 on the 5th for
Oh,
what
there
it's
you go.
worth. I just thought I'd share that, just to have this on it. But you have everything here anyway. That's right. Good. Maybe we move on. Yes.
So I just want to point out too, in response to your comment, Priya, that we, as concerned as I am too about, limiting the rights of what, can be discussed, a legitimate, civic project like might happen. We also have to protect a well-meaning teacher who holds a debate activity, and the debate activity happens to be 24-0 in one direction, or even more potentially dangerous to the teacher, 22-2 in a particular direction, even though the teacher is just maintaining a fair playing field. What we might gain by having it be a classroom lesson could be a very unfair but potentially bad problem for the teacher too. So you have to protect them as well.
Well, who calls it?
Go ahead. Go ahead. I'm sorry. I tried to multitask.
The other piece is if you were the two students. That's the other piece that gets really uncomfortable if everyone goes one way and everyone's in the minority response, and that's usually when it gets really uncomfortable. And that's when we'll learn about it, because a student will go home and talk about what occurred and how uncomfortable they were with the conversation and feel that a side was being advocated when technically the side was being advocated by fellow students. And we see this with presidential elections, and so forth. And so if they feel like their voice isn't heard or they're uncomfortable, then it doesn't feel good for the student either. So not that you can't have healthy debates, but I think there's always that risk in something like this.
Well, any other comments before we move on? First Sergeant, is it okay to move on?
Carry on, please.
The last item has to do with gifts.
I have a feeling I'll have more questions on this than the previous policy we just talked about. We put together a public gifts to the schools policy that incorporates a number of different aspects of old policy. As you know, we're in the process of updating our older policies and bringing them in compliance with state law and federal law as necessary. So that's, we have been working on this. Alan has been working with me on this policy, and we also included in the policy provisions should the board wish to go down the road of naming rights, and we have done some naming rights here in the district with various fields and auditoriums. So this outlines the process that would be in place for naming rights, but reserves the right to the board to go down that path. We outlined a number of governance questions for you. The first governance question relates to the ability of building administrators and central office department heads to accept a gift on behalf of the district rather than having to wait for the board to accept that gift. When we looked at other district policies or other board policies in similarly sized districts as well as the neighbors, most all of them have this in their policies, allowing building principals and department heads to accept these small gifts so that the money can be used immediately. Oftentimes we get smaller gifts for field trips or various immediate need things that come into the building, and this would allow quicker access to those funds than having to wait for the board to accept that gift at the next regularly scheduled board meeting. I put the number $200 in there because that was on the lowest end. It's definitely up to the board as to what number you're comfortable with. If you are comfortable with a number, the highest amount that I found was $1,000, and that was the Madison School District. That allows building principals and department heads to accept gifts up to $1,000. As noted in the board, or in the policy, the board will still provide recognition for those gifts, so all donors will be equally recognized irrespective of the size of the donation. The next governance question was whether you would agree to adopt criteria for the acceptance of gifts. Again, right now our policy is not clear on what those criteria are. Ellen can give you various examples of typically equipment that comes in that very well-intentioned donors have when they make equipment donations, but sometimes it's equipment that we can't use, particularly with IT equipment. So we set forth various criteria so that on the outset, donors would know what our criteria is for those types of donations. And then finally, we set forth naming rights procedures for district facilities, if the board would want to adopt naming rights. Do you have anything else, Ellen, to add?
Any questions, concerns? Mr. Becker?
I'd be comfortable going larger than the 200. I mean, I would assume you may have found the 200 in some small districts.
Actually, no, Appleton School District, which is a little bit smaller, but I forgot what other, I want to say Racine had $200 as well.
Who had the 1,000?
Madison.
Just Madison?
I believe, well, there's not too many that are about our size, so.
I suppose. I guess 200, I think about if there's a, if there's a large event at Preble and someone had a $500 donation, that could be spread pretty thin pretty quick if the event was big enough, just because of how large the school is. And I'd like to think we could do a $500. It still goes through the principal. It just can be processed faster than a wait for the board meeting thing. So I'd be okay with that. That's fine.
Yeah, I would concur with that. 200 isn't sadly what it used to be.
No, it isn't. It isn't.
And I don't know what the dollar amount should be. I'm certainly comfortable with 500. I don't have a sense of the donations that have come in. Said 500, take care of most of the small stuff that comes in. Moving on.
When I sign those, I mean, I think 500 is reasonable. 200 is like 6 pair of mittens. I mean, sometimes it doesn't mean much anymore, but I think 500.
I guess it could be.
Yeah, it could be.
There's going to be a fair number higher than, over 500.
Yes.
Do we have parameters for like parent groups who plan like the graduation parties, the lock-ins and things like that? I know in the past they've had in-kind donations of things like tanning sessions, which I think is a health issue. And I don't know that we should be promoting
like tanning
sessions, tanning salons.
But don't you have to be 18 to go there?
I don't know what the.
I think you do.
Yeah, I mean, I think you have to be
It's like
18.
your parent signature. We know lots of girls that go less than 18.
Yeah.
Oh, with
yeah,
their parents' signature.
But I mean, we're giving these as gifts. These are door prizes or things at their graduation parties and things like that. I think we need to have.
Do we have any authority over that if it's a parent group?
If it's not a group that's sanctioned by the Green Bay Area Public School District, I don't know what authority we would have.
Even
But
if
we can
it's
look into that.
an
Such as
activity.
the booster clubs would be another
Right.
group.
Yeah.
It's quasi-sanctioned any way you look at it, in my mind,
I
because
mean, the
it's
PTOs
using the school
themselves,
name and
Right.
teacher organizations,
Advertising.
peer networks.
Oh, yeah, they think they have so much more access than they actually do.
But
Now, granted, some of those donations that come from the parent network would come through here because they may be donating money that would be to buy something at a school. So.
Well, we do see that, we would see the in-kind donations, because I remember seeing the list of tanning sessions. I forget which high school had it.
Oh, really?
As part of their, yeah.
I guess, you know, I think it's interesting. I think that's.
I just think we need to be mindful of.
I don't know that I necessarily want to, because I mean, there's a lot of things that probably need to be parsed in that regard if we're going to start parsing tanning sessions.
And who decides?
Yeah,
I mean, do we bring them all to you?
I think I'm very comfortable if people want to bid on a tanning booth session and spend $20, and it benefits the Booster Club, and they want to go and open themselves up to skin cancer, that would be their problem.
And it's a legal activity.
Yeah, it is a
for
completely
people
legal
that-
activity. Yeah, I mean, I'm not in love with it either, but
all right.
I feel like it's a can of worms.
Oh, it is, but.
Because then it's what kind of food can be a prize, and then
Yeah,
it's
exactly. I want to be able to sell candy,
then it
quite
could be the
frankly.
size of the drink.
Are you going to buy broccoli? No, you're going to buy candy, right? Or Buffalo Wild Wings, right? I want to be able to sell that.
The drink,
Exactly.
the 2 liter is okay, but a 64-ounce wide mouth cup is not. Then we don't want to get into that.
All right.
Well, I think to
Big proponent of
Katie's,
Diet Pepsi, I don't know.
I think to Ms. Maloney's point is we try to educate people out there, think in terms of what's healthy physically and mentally.
Here's your prize, but be careful.
Enjoy the carrot.
I think that's part of the building's responsibility too, to be working with those groups and when they're doing those things.
Right.
I see that really coming out on building level, advising the groups what would be appropriate.
And some of that comes through our wellness policy as well, which needs to be looked at.
So,
Well, some
anyway.
should come through our health classes too, I assume, that part of it.
I'll set on that part.
Yes.
Under question I have, under process for the acceptance of gifts, it's on the first, it says first reading. If you can find it,
Which
so
one?
I'll get to it.
Process for the acceptance. Are you in the
Roman numeral 3,
841?
process for the acceptance of gifts. I think it was the fourth document down.
Yeah, oh, okay.
Okay.
You're on the rule?
Last time.
Under the rule.
In the rule. Yeah.
I don't want to go back because I'll never
Wait,
come
hold on
back.
a second. I know, it's so hard.
The rule is the
For me, it is.
The rule is the
You have to
fourth
open the
document down. Okay, where are you now in it?
Roman numeral 3, process for the acceptance of gifts.
Second to last page, I believe, or the last.
Okay.
Process
there it
for
is.
the
All right.
acceptance
Of
of
gifts.
gifts.
Page 5.
Which I'm still not there. Hold on.
Second to last page. It
Process for-
starts on and then last page. Okay, go ahead.
Go ahead, Chris,
Okay.
before you lose it.
Okay, under B, talks about monetary donation, blah, 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 and then provided to the business office for acknowledgement by the school board. Then we go to C, greater than 200 for the copy to the business office for acceptance and acknowledgement by the board. And then the next one, D, for monetary donations to the district, it goes back to only acknowledgement by the board. So I guess I need
Yeah, it should say.
understand why some are acceptance and some are by the board.
So B is the smaller gifts that the principals or district office individuals can accept, so then the board would only be acknowledging those.
Okay.
C is acceptance and acknowledgement, because those are the larger gifts.
Uh-huh.
D should say acceptance and acknowledgement, because those are donations to the district at large, so there wouldn't, such as I'm donating $100 to the Green Bay Area Public School District. That's not, there's no one to own that $100 except for Ellen. So that would be accepted by the board as well. So that, you're correct, Chris, that should say acceptance and acknowledgement.
So,
We'll change that to 500, right? Okay,
Yep,
from
we'll
200?
change those to 500 based
Okay.
on your feedback, and then D needs to add acceptance and acknowledgement.
But it's still going by Ms. Powell, right? You're still seeing it, though. Somebody down here is,
Yeah, we've talked about what that process is, and it's with myself or Terry or Mark, whoever oversees that level or
Jeez.
designee, but yep.
to me, it's more in case you spot something that just doesn't look like
Correct.
kosher.
Yep, and Dave T. probably looks at it.
Anything else on this?
Yeah.
Yes.
Yeah. I think, I don't know if I missed it. What about the form of the donation?
It's the first document.
The first document.
Right, the
Actually,
first
I had problems opening, to be honest.
Did you?
I did. So let me just ask the question then. Hopefully I'm not too repetitive. So, for instance, when you get money for a political campaign, you make, if you're smart, you make copies of the checks, deposit the checks, you write the checks down in a ledger. If you get money, if you're really smart, you also, I mean, I've even seen, I didn't have to do that, but I've seen political candidates make copies of the bills, actually, which I'm not advocating that we do, especially if it's $500. So what form is an acceptable donation for us? Does it have to be a check? Does a check have to have a person's name on it? Can it be a money order? If it's a money order, what is that? That's what I mean. Did that first document address that?
Here, this is it.
I wouldn't
No,
advise
not that.
photocopying in cash, because that's.
Let me tell you, I've seen political candidates do that. I've seen them like, okay, I'm going to photocopy this and
We have
put
a
this-
word for that.
I've never done that, but I've seen them do it. I have.
Shrink it at a great ratio, I think.
No, you cannot.
You can't do that?
Photocopy.
You
It has
used
to
to
be
be able to shrink it beyond a certain level,
Yeah.
it's okay.
No.
Legal tender. So was that's not, I don't mean a
You
form
don't
that
need
someone
that form.
fills out. I mean,
Is there a preferred form?
Yeah,
for it?
Alan,
Yes.
I'll defer to Alan on that.
I mean, should
Oh, that
we
first
accept a
check.
check with no one's name on it?
Check, money order, cash, do we have a preferred way of, or are we just happy to get it and we'll take it any way we can?
Small
I don't
unmarked
think
bills.
we've ever said we wouldn't take it any way they can.
So, you see what I'm saying? So, like a
I mean,
check.
if someone comes in and, you know, the school should be writing them a receipt.
Yeah.
If they're, you know, in person, regardless of what money they bring in. Your concern is they shouldn't bring in cash?
No.
Oh.
No, I think if people want to give cash, I know if my father was going to give money, it would be cash. So, you know, if they want to give cash, it's fine. But I guess, did you discuss like a money order or even a kind of, you know, there are starter checks. There are checks that aren't, that don't have people's names on them. The account holder's name.
Has there ever been an issue with a
Is that
check
an
not
issue?
clearing?
No.
No.
Well, they may
If it's a
not clear
donation
because
and
of
it doesn't
non-sufficient
clear,
funds, but
it's,
then
they
no
have not
big
had
deal.
checks that
Okay.
haven't gone through the bank.
All right.
They may not have funds to cover the check, which has happened, but.
Right.
but it's a donation, and if it doesn't clear, it
Then
doesn't
not
clear.
a
It's
big
not like
deal.
they're trying.
And normally, if the school gets money, they deposit those dollars, and we have an account number. We have an account for within our own accounting system for every school, and all those monies go into that account number. And we see the revenues, and we also see the expenditures of what they're spending it on. So if they get what's the community grant? The Greater Green Bay, you know, if they get a $200 grant, it goes in there, and we can see, you know, if someone has a question on what was purchased, you know, we have that information in there. And out at the schools, they usually are tracking that. You know, here's the money, so this belongs to, you know, this group, or, you know, what was this money, you know, received for?
Is it fair to say everything has to have a paper and/or electronic trail?
I mean, there should be receipts. Now, we usually they deposit the money and tell us what account number. Here's the deposit they're going to make. It's $1,000. And here's what account numbers they should go into, because some may be student fees, some may be parking fees, some may be, but there is one account for the gifts to go in, and the money carries over every year, so they don't have to worry about spending all of it. Which we had that concerns in previous, you know, they're concerned that, well, if they don't spend it all this year, they're going to, down to the DOB, they're going to take it away, and it rolls over every year, so. But it is one account where their gifts, monies that they get. And then again, they fill out the gift forms that are coming to, and that's where we get the information to put the list of items in the board agenda. And also then from that, we mail merge it to create the letters that go out to the donors that Brenda signs.
And then that letter serves as their receipt for tax purposes?
Correct. Yeah.
Who determines the monetary value of in-kind donation?
Well, when I got 50 used Reader's Digest, I had to go to the Reader's Digest Blue Book and figure that out. I mean, we usually come up with a determination.
Okay.
I mean, certainly these people can, can always choose differently, I imagine, what they thought the value of it is, but we don't get into too much. It doesn't come in too much because a lot of it doesn't have to be, we don't have a lot that are, there could be, used athletic equipment, or used treadmills and those type of things. And if they go to David, David kind of knows, and Dave Teat will look at whether they're safe and, kind of eye those things before they will ever get into the schools. And those usually, and those forms that have those type of items should be going to Dave, as well as IT. We are going to have to sooner or later get to Diane or Kim to Diane, when there's those type of things that we.
But do we have to put a dollar value on that when we send them a receipt, or just acknowledge what we got from
And
them?
I don't know
It's up
that
to
we
them.
necessarily do. It would be like going to Goodwill and they write down that you have 5 bags that you donated.
Right, but when on the consent agenda, there's a dollar amount assigned to every gift, whether it's cash or.
Where are you seeing that?
Isn't it on the gift section of the consent agenda? Don't we assign a dollar amount?
We usually determine the dollar amount. Most of them come with a dollar amount on there. So
Yeah,
we
even
don't,
if it's in kind or cash, right?
But we will, if it's a piece of furniture, we'll call Dave and say, Dave, what do you think that, the value is? We don't spend a whole lot of time on it because, we're not going to argue back and forth with people that their items are worth more or less. Doesn't come up that often.
All right.
Okay. Can we move on?
We certainly can. Yep.
Thank you. That's all I have.
All right. We have a closed session, so I'll read that motion. Closed session has been scheduled for Monday, February 3rd, 2014, immediately following the adjournment of the work session meetings. Pursuant to Wisconsin Statute 19.851E, deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session, more specifically to wit, potential property contracts. Pursuant to Wisconsin Statute 19.851G, conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it is or is likely to become involved, to wit, potential litigation matter. And pursuant to Wisconsin Statute 19.851C, considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility, and pursuant to Wisconsin Statute 19.851F, considering financial, medical, social, or personal histories or disciplinary data of specific persons, preliminary consideration of specific personnel problems, or the investigation of charges against specific persons except for paragraph B applies, which, if discussed in public, would be likely to have a substantial adverse effect upon the reputation of any person referred to in such histories or data or involved in such problems or investigations, to wit, personnel matters. The meeting will begin in open session to consider the appropriate motion for a closed session so provided by law.
Second.
Sandy? Maloney? Warren?
Aye.
Franz?
Aye.
Jeffries?
Aye.
Becker?
Aye.
Waitman?
Carried 6-0. We'll move across the hall for our closed session.
What's your tomorrow?
For more information or to obtain copies of this program, contact CISA 7 Interactive Learning Services at 920-465-5218.